And a survey conducted by research firm IPSOS revealed that 16% of Kenyans believe that Africans cannot get COVID-19, while 21% of the respondents believe that it can be cured by taking garlic. 100 days later, those myths have been busted with the rising number of cases in the country. But despite all this, there are those who still hold the belief that the virus is just a figment of someone's imagination. Waihiga Mwaura set out to explore the different perceptions of COVID-19 in Nairobi County, and this is what he found out.
Indeed, tomorrow, the 20th day of June 2020, marks 100 days since the first case of COVID-19 was reported in this country. And within that time, over 100 people have lost their lives within Kenya's borders, and over 4,000 positive cases have been reported. But in the midst of all this, there are still those who believe that COVID-19, it doesn't exist.
Corona hakuna, yenye iko ni serikali tu inatafuta yenye njia itapata pesa kutoka kwa nchi zile za huko juu. Tuongee ukweli. Hao madaktari, kuna mmoja alienda kusema mambo ya corona? Kuna daktari mmoja alienda kusema mambo ya corona?
According to University of Nairobi sociologist Dr. Kenyans, the human mind can respond to fear or pain in different ways. For some, it is outright denial, whilst for others, even if they believe in the virus, nevertheless, their optimism bias will convince them that they are safe.
When HIV and AIDS hit us in 1985-86, everybody who passed away was given a different postmortem, social postmortem. Oh, this one, he looked at his dad and his dad cursed him. This one did this. Nobody wanted to admit that somebody died of HIV. And that's the problem we had at that time. So then until a cousin of yours or a friend of yours went down, you'd be like, nah, this thing, people are just talking about it, but it has not reached us. That's the thing with COVID.
Shocking photos of young people socializing in Nairobi bars or outdoor areas like Ngong Hills without regard to public health rules caught many by surprise.
You're talking about a situation where the risk is visible, but the level of optimism is so high that they think it is part of the baptism by fire that they have to go through.
But it isn't just millennials who are guilty of breaking the rules. Kenya's political class continue with their defiance, holding meetings in brazen disregard to social distancing guidelines.
As soon as you're elected into leadership, it seeps into your mind and you start feeling like you can patronize everybody else. So we lay restrictions and say, don't cross this boundary beyond Nairobi to Athi River, don't go to Kajiado, stay there, make sure you observe curfew. But then the political leadership, they think they're the ones who set those rules and they don't have to follow them.
On the flip side, however, 71% of Kenyans are worried of the rising curve. According to an InfoTrack survey released in early June, they are concerned that indiscipline when it comes to following government directives on COVID-19 could hinder the fight against the pandemic.
Hata wateja wengine waamini, anakuja anataka kushikashika vitu, so inabidi ukue mpole na umwelezee kwa utaratibu ya kwamba ugonjwa upo.
Lakini ukisikia watu kama nusu ya nchi wakisema huyo ugonjwa uko na wale wako ng'ambo wanasema iko, siwezi kabishana, lazima uamini pia hii kitu iko.
But for the doubting Thomases,
so tuachane kutudanganya, tuambie ukweli, hakuna, watufungulie biashara tuendelee.
Nothing, it seems, will cause them to change their minds. Reporting for Citizen TV, I'm Waihiga Mwaura.